Good evening, everybody. Welcome to When Physicians Become Patients, personal stories of mystery illnesses, misdiagnosis, and recovery from Dr. Neil Spector and Dr. Bill Rawls. I'm Tim Yarbrough, and I'll be your moderator this evening, joined shortly by Dr. Bill Rawls and special guest, Dr. Neil Spector. We are really looking forward to sharing this evening with you. We'll have a great conversation with both of these doctors, sharing their unique perspective of physicians turned patients. And stick around after the interview. We will have a live Q&A. We've read through the hundreds of questions that you all sent us and we've crafted an interview that will hopefully respond to as many topics as possible that you all asked about. And then afterwards, we will have time to do some live Q&As, so stick around for that. If we aren't able to get to your question, feel free to send an email to info@vitalplan.com, or you can visit rawlsmd.com to check out a lot of great articles and blogs there that might answer your questions. We do have a great chat moderator staff here tonight, but due to the number of chats, sometimes we can't respond to everybody, so we ask that you keep those brief and of a non-medical nature since we're not a medical practice. And just want to emphasize that none of the information in this webinar is should be considered as medical advice. So please do consult with your medical provider before you make any modifications to your lifestyle or medications, etc. So Dr. Neil Spector and Dr. Bill Rawls will be with us in just a few minutes here. They were recently featured on People's Pharmacy together. And here's a picture of them at a recent conference in the Northeast. Dr. Spector is a leading oncologist and works at Duke Hospital and is the author of the memoir, Gone in a Heartbeat, A Physician's Search for True Healing. Dr. Bill Rawls is the medical director of Rawls MD and Vital Plan and has written on many topics from Lyme disease to fibromyalgia to chronic fatigue syndrome and a variety of other health and wellness topics. He's also the author of Unlocking Lyme. And both of them are really passionate about sharing from their experience, personal and professional, about helping people accelerate their recovery and navigating through a variety of chronic illnesses. So Dr. Spector and Dr. Rawls, if you would go ahead and join us now, without further ado, we'll introduce you. There we are. Hi guys, thanks for joining us tonight.
Hey, Tim.
Great. Well, I just want to start off, if we could, some folks are familiar with either one of you or maybe both of you, but for those that aren't, Dr. Spector, would you start out by just sharing a few minutes about your story of turning from a physician to a patient?
Sure. Yeah, thank you. First of all, Bill, thank you for having me and inviting me down here.
Pleasure.
And your staff.
Absolutely.
It's tremendous. And thank you for feeding me too.
Well, thanks for coming. Yeah.
My story is probably like a lot of the listeners will be able to relate to this. I was in my mid-30s and thought I was the model of health. I ran Boston marathons, lived in Boston at the time, used to run 10 miles a day, 6 days a week. Never smoked, did all the right things. Maybe I did too many of the right things. And had a great job. I was an oncologist at one of the top cancer centers in the world, Dana-Farber Cancer Institute, doing research, loved what I was doing. And then over a relatively short period of time, my family, we moved from Boston to Miami. I took a job at the University of Miami, and literally within weeks of moving, became debilitated. So I went from running 10 miles a day to barely being able to walk 10 yards without feeling just completely fatigued. I started having arrhythmias. I would have these episodes that might last 30 seconds, 40 seconds of just a racing heartbeat, 200, 250 beats a minute without any particular reason. And as a physician, I knew that something was wrong. I had an episode of brain fog where I tell people it was like taking 50 milligrams of Benadryl every 2 hours. I mean, I was taking care of very sick patients. I tell a story where I gave a talk to a basic science department about my research, walked out, somebody said that's really fascinating, and I had no recollection of what I had just spoken about for an hour. Anyway, this went on. I went to my doctor, who was very compassionate, was a colleague of mine at the university, ran the usual blood counts, chemistries, liver function, kidney function, everything looked normal. And so at the end of the day, I was told all the time that I was stressed. You know, I'd moved from Boston to South Florida. It was an adjustment in moving. I was starting, you know, a new faculty position, had a laboratory, and so and was in and out of emergency rooms constantly. For someone who had really been the paradigm of health, I went from that very quickly to someone who could probably write a book on every emergency room in South Florida. And with every emergency room visit, I would get the same response. We can't find anything wrong. They do an EKG. I had some Holter monitors. I was never able to capture those transient episodes of rapid heart rate. And, you know, I was told that I needed biofeedback. I needed to see a psychiatrist. I needed to go on, you know, an antidepressant, all these things. I knew all the time that I had been stressed in my life. I mean, back in the days of residency, before hours were restricted, I'd worked, you know, 130 hours a week in a very busy hospital and had never experienced anything like that. So for 4 years, I went on, I did biofeedback, I did meditation, all the things that were asked of me, and I loved it, still enjoy doing those today. But at that time, my symptoms did not improve at all. And so finally, after 4 years and feeling like any morning I might not wake up, I mean, it was just, I knew that I was dying of something. I just didn't really know what it was. And again, the symptoms really were very cardiac in my manifestations. Cardiac and fatigue, the arrhythmias and the fatigue. And so, and had other things like burning sensation in my heels, very dramatic. I tell people they were really night terrors. They weren't like nightmares. Profound insomnia. I mean, to say I was insomnia would really not be doing credit to what I was experiencing. Finally, after 4 years, I developed a persistently slow heart rate of about 40 beats a minute, which if I had been running marathons, I hadn't really done anything in 4 years, you know, that might be okay. But for me, there was clearly something wrong. And I also started having these episodes where I would wake up in the middle of the night with these explosions, these white light explosions, headaches, and continue to have these intermittent episodes of tachycardia. And then out of the blue, for the first time in the 4-year history of my disease, I developed arthritis, really profound arthritis, joint swelling, could barely lift utensils in my hands. And I had been prescribed doxycycline for a completely independent reason. And within a very short period of time, the arthritis resolved 100%. And so I said to my doctor, I have Lyme disease. Now, of course, in Florida at the time, and probably still today, Lyme disease was 120 out of their list of, you know, the top 100. And so they said, Lyme disease, you know, we're not quite sure what that is. They were going to put so I had a cardiac monitor at the time, which finally revealed what had been going on for 4 years, which was that I was having episodes of ventricular tachycardia, which is a potentially life-threatening arrhythmia and one of the most common causes of sudden death outside of a hospital setting. And I probably had thousands of episodes over the 4 years and was, I think, very lucky that I didn't die with any one of those episodes. The white blinding light was the fact that I was having pauses between heartbeats of 6 seconds. So for 6 seconds, my brain wasn't getting blood flow. And the slow heart rate was that I had what's called third-degree heart block. It's not that the vessels were blocked, it's that the electrical system in my heart was screwed up and the impulse, the normal impulse that we take for granted. We normally don't think about, you know, why we have a heart rate of 70 or 60 or whatever you have, but it's because we have an exquisite electrical system in our heart. Mine was shot, which is a classic sign of Lyme disease. And so I made my doctors do the test. They were going to put a permanent pacemaker in. I said, you know, wait a minute, let's figure out if I've got Lyme disease. 4 days later, I get a call from the head of cardiology who says, Neil, your test is negative. Now, at the time, I didn't really know what a negative test meant. I figured a test is negative. I had the test sent to a reputable, what I thought was a reputable academic lab in the Northeast, an Ivy League institution that shall remain nameless for the time being. And so they put a permanent pacemaker in. And I didn't get better with the pacemaker. My doctor said, you'll get better, you'll feel better, your heart will be regulated. Didn't get better. They finally ended up putting a defibrillator pacemaker in because I continued to have ventricular tachycardia. And eventually I had the test repeated several times. And finally, I'll never forget, several months later, around Halloween, my doctor called me and said, you know, great news, we figured it out, you have Lyme disease, your test is positive. I was treated very aggressively. I had a PICC line put in. I received daily intravenous antibiotics, ceftriaxone and some oral antibiotics. Almost all my symptoms resolved. The burning sensation, the fatigue improved, except that my heart never resolved. So the damage that had been done was permanent, and I continued to require a pacemaker and defibrillator. And for the next 11, 12 years, actually, I lived with what I found out several months after the pacemaker was put in, which was a severely damaged heart, about 10% heart function, and managed to, we'll talk about some of these things later, but managed to live a very productive life, developing 2 cancer drugs that are molecularly targeted, coached my daughter's soccer teams, got shocked along the way, which I describe in the book, which is an experience I wouldn't wish upon my worst enemy. And finally, in 2009, I'm coming up on my anniversary, over the summer of 2009, went into florid heart failure and required an emergent heart transplant to save my life. And now I'm back to living a very productive life, feeling good. My wife told me that I've had my 1 body replacement part for my life, so I'm not running marathons. I've run a few half marathons and still run, but I'm very thankful to be alive today. And so, Bill, I'll let you tell your story.
It's a striking story. It's interesting that we have had such a similar course, but different outcomes. I've been a physician for 30 years. I was trained in obstetrics and gynecology and had this ideal of getting the best training that I could and taking it to a rural area on the coast of North Carolina, which I did. Practiced for 15 years, and in my late 40s had similar situation to Dr. Spector, that my life was just turned upside down. First with severe insomnia and basically the burning feet, all those same symptoms I went through, along with the cardiac manifestations. Skipped a beat, constant chest pain. My heart was skipping beats every second to third beat. I didn't get the severe heart block, but I had fairly severe cardiac manifestations. Ended up with a cardiac cath, Holter monitor, everything, and they basically said, well, we can give you this beta blocker and it might help some, but otherwise we don't have much to offer, which was before that I knew when I had Lyme disease. And it was later that that became evident and the testing was finally positive. And I tried courses of antibiotics and just got sick every time I used them. They just tore my GI tract apart. Became frustrated with the medical system. By then, I had basically lost my job. I couldn't practice obstetrics and gynecology, so I left the practice that I helped found and started a little medical practice with this idea of wellness, that I was going to make myself well and help other people do the same. Became frustrated with the medical system and basically took a leap of faith and began not only changing my lifestyle, but taking very high doses of a very wide spectrum of herbal supplements. And over a 5-year period, gradually got my life back. So it's definitely a different way of looking at a very similar situation. So it's a different perspective, and I think Dr. Spector and I are both learning from each other, and the things that we can bring to the table from both of those angles are really important.
Yeah.
So we'll go at it here.
I wish that you'd been in practice when I was sick. I would have definitely come to you. So
it was desperation. You know, I didn't have the funding. You know, we had 2 kids in college and all these expenses, and I suddenly lost my income, and I couldn't go to big institutions. I couldn't go to Lyme doctors. I really couldn't afford it. I couldn't leave my practice. I didn't have a diagnosis. I couldn't declare disability. It was pretty stressful times, but it forced me to do things that I don't think I would have done otherwise, because I had no other options. You know, it was sometimes you do what you have to do,
Right.
and your intuition leads you in a certain direction.
Right.
Yeah.
Gut instinct.
Yep.
Yep.
Thanks for those stories, guys. It's great to hear the background, I'm sure, for everybody, and cool to see how you guys are learning from each other and teaching everybody about your different perspectives. Dr. Rawls, if we could, we're going to direct the first question your way in regard to testing. Can you speak a little bit about some of the shortcomings or even lack of testing for conditions like Lyme, chronic fatigue, fibromyalgia, and other lesser known conditions?
Sure. It's I think it's, first of all, we tend to look at microbes from the point of view of a microbe causing a illness. And that's very true for highly virulent or microbes with high potential to cause illness, tuberculosis, Ebola virus, things like that. But when you look at these lower grade things that are just working in the background causing chronic illness, they're much harder to find. And often it's not one microbe, it's a spectrum of microbes and how they are affecting the immune system. So I think one thing to talk about is the difference between testing in acute illness and testing in chronic illness. When you have an acute infection, Borrelia, the microbe that's commonly associated with Lyme disease, you've got an acute reaction by the immune system, and you've got the microbe in transition from where it entered the body through the bloodstream into tissues. So you've got this window of opportunity that not only are you going to be able to affect it better with antibiotics, but you're also going to be able to have an easier time of finding it. But once that thing becomes disseminated in the body, it's in very, very low concentrations in tissues, the immune system reaction has become more attenuated. So when we look at testing, most of the standards, you know, the sensitivity of the test, how good it is in picking up the microbe, mostly what they're looking at, they're defining the test in terms of what it will do to pick up an acute infection. So basically, they're taking that test and they're taking a known population of people to see how well that test performs, and a population of people that we know have the microbe. So it's so if it's a 95% sensitivity, then there's a 95% chance that if you've got that microbe in your body that you're going to find it. But that is, we're looking more at acute infection. So, but most of the people out there are having chronic symptoms. So by the time that infection becomes chronic, there's less probability that testing is going to be good, at least with the tests that we have today. You've got direct testing for particles of DNA of the microbe, PCR, and you've got the reaction of the immune system called serology or antibody reactions. Both are valuable, but both start to lose some of their value when you look at testing in a chronic population of people.
Great, thank you. And Dr. Spector, you've written a lot in your book about the medical system's over-reliance on testing. Can you speak about what doctors should be doing instead to diagnose patients?
Sure. Well, yeah, and I think this goes well beyond just Lyme disease, and
Sure.
You know, first of all, just to make a comment about Lyme disease. You know, we speak of Lyme disease as if it's one disease, as if everyone has the same illness. I make the analogy that this is very akin to the way we talk about cancer. You know, people talk about cancer as if it's, you know, the cancer is one disease, like every cancer is exactly the same. We know that there are thousands of cancers. You know, women with, we don't even, as an oncologist, if someone says to me now, I've got breast cancer, that really doesn't mean all that much anymore. And so it's much more complex. And so I think for the audience, you know, we'll use the term Lyme disease, but what that really means, I think, Bill, as you said, is this is like a polymicrobial, I mean, many, many organisms, some of which we know about, some of which we don't know about. So I think when it comes to this era, we're in an era now that people talk about precision medicine. Some people call it personalized medicine. I gave a TED talk a little over 2 years ago. The title of the talk was The Impersonalized Nature of Precision Medicine. I think that the lay population thinks that personalized precision medicine means that you're going to have, for those of you old enough to remember Marcus Welby, you'll have your doctor over your bedside telling you, holding your hand, I'm here with you. We're moving in a direction that's about as far from that image as you can imagine. And so we're moving into this genomic era where everybody, to be honest with you, when you're born, infants will have blood tested for their genome, and it'll end up on their phone when they're old enough to get a phone. And so you'll carry around your human genome. Now there's people who promised the Human Genome Project, which was a massive undertaking to clone the human genome. I think it was a tremendous scientific feat. But we were promised as taxpayers who paid for that it would solve the ills of society. We'd figure out diabetes, high blood pressure, you know, cancer. It's all in the human genome. Well, the sad thing is it's not all in the human genome. It's not, you know, your genes are part of the story, your environment, what you eat, what you do, whether you lay around, whether you exercise, whether you don't, whether you're stressed. And so, you know, we've ended up with this wealth of genomic information where we can, you know, we could take single cells out of the blood and sequence them. And yet we still have people who are chronically ill and aren't getting better. And so I think, and I still, you know, I'm in a major medical center. I teach young physicians in training. And often and I'll tell them, I'll say, did you examine the patient? And they'll say, no, you know, but I'm on the computer, I'm looking at the labs. I'll say, no, you go in the room and you lay hands on. Yeah. Number one, we know that just touching a patient is therapeutic. You know, I always hug patients because I know, I mean, as a patient, I always enjoyed when my doctor hugged me because, you know, you're releasing endorphins and good things. It's therapeutic. And so we need to get away from somebody staring at a computer screen, looking at labs, and getting back to taking a history. I made the analogy once that taking care of a patient is like having a painting a mallet with different colors. Yeah. And the job of a physician is to, you've got a blank canvas and you've got to fill in and paint the portrait of that individual. Some of that is genomic data, some of that is travel history, some of it is family history. It's what they eat, some of it is how much do you exercise, how well do you keep your stress under life. That's painting the full picture. You can't just use one color, which is a lab test, and expect to have that person down pat. And so, so my fear is that we're laying less hands on people, we're listening less. The average physician's appointment in the US is about 15 minutes. Yeah. And for anyone who's gone to a doctor lately with electronic medical records, you're sitting on the table and they're typing it because if they don't complete the record, they get penalized. Yeah, you don't get as much funding. Yeah, so you don't even, not only is your doctor not touching you, they're not even looking at you half the time. Yeah, it's true. And as a patient, that really bothers me. Yeah, to just further that idea of their genes, our genes are really important, but we at any given time, we're only using about 1% of our genetic material. So we have all these redundant genes that it's basically a record of hundreds of thousands of years of human ancestry that's recorded in those genes. And so there are many genes that we don't use. In fact, most of them we don't use. But the concept of epigenetics, I think, is very important. And that's basically the concept that environmental factors
can turn off or turn on genes. And so when you look at how environmental factors are influencing our genes, the environmental factors are much, much bigger and more important. So what you do, how you go about life, what you eat, how toxins you're exposed to, all of these things are affecting your genes. And I think that's really important. I mean, even people with really bad genes like the BRCA genes, we look at a really high rate of cancer, but hey, there are more people with those genes that don't get cancer than do get cancer. And what that says is, even if you've got the worst genes, there's still things that you can do to affect your environment to bend things in your favor. Sure. And I think that's really remarkably important.
Yeah, well, and I completely agree with that. I'll give you an example of sort of a little pearl for everyone watching here. There's going to be plenty of pearls here. So there's been plenty of studies done in animals showing that if you take two mice, one has a human cancer, breast cancer, that's been done with breast, ovarian. You take one mouse and you put the cancer in, and then you separate that mouse from its litter mates. Now that's an incredible stress for mice. Mice like to be with their brethren. And you take the other mouse that has the same cancer, but you keep it with its litter mates. You know what happens? The mouse that's separated, that's stressed, that tumor metastasizes like crazy.
Yeah,
goes
really
to the lung, goes to the lymph nodes, and people have actually mapped that out to be related in part, because I'm not one who ever thinks that it's as simple as one thing, but they've really mapped it out down to the sympathetic nervous system and what they call the beta adrenergic receptor. Now, it's interesting because the primary tumor isn't really affected, but people with cancer don't die of their primary tumors. They die when it metastasizes. Sure. And so you can stop that metastasis in these mice by giving a beta blocker. Now, I was on a beta blocker. It sounds like you maybe they're terrible drugs to take.
I didn't tolerate them. They worsened my insomnia, and I never could take them.
Yeah, I had to take it when I had severe heart problems. But what I tell people is, so they'll say, like, why aren't we giving everyone a beta blocker? And I'll say, you know what? There's other ways to reduce the sympathetic system. Sure. Meditation, exercise, whatever calms your mind, painting, dancing, singing, whatever it is. That's sort of a safe beta blocker. That's nature's beta blocker, listening to music. Yeah. And so, and so what we need to do is, but very rarely, how many times have you gone to your regular doctor, and have they had the time or the inclination to have a discussion about how stressed are you? Like, what's going on in your life? I mean, it's generally like, how do you feel? You look great. Your labs look great. I'll see you in 6 months. And so we need to get away from that.
Just want to loop back around to one more follow-up on the testing question. Given the number of false negatives, when is testing a beneficial thing to do? When should people think about using a test?
Are you asking me that one, Tim?
Either one, whichever one. When can it be beneficial?
I'll take that one. You're on the testing.
Yeah, I think the testing is valuable. I think everybody wants to be tested. We want to know as much information as we can know. And from that point of view, I think gathering information is very important. But gathering information or doing testing just for the sake of testing can be even harmful. So I think you have to be careful of that. One thing that I used to teach medical students, and I've been teaching it to patients ever since, is before you order a test, answer the question of how the outcome is going to affect what you do. Whether that's your management or how you're focusing your recovery or whatever you're doing, answer that question before you get that information. And if the answer is, well, it's really not going to change anything that I'm doing, then that test has more potential for harm than it does good. So yes, we all want to know as much as we can. I tested for the Borrelia, but as I came to know Lyme disease and recognized there were more and other infections, I didn't go on this great microbe chase to chase down every one of them because I recognized that it wasn't really going to change anything that I was doing. So I think a good strategy that I teach people is, build out that restorative base, change your lifestyle, do all the things that you can to forward your recovery, and get basic testing that may be beneficial along the way to help you answer questions. But then if your recovery is improving, then the need for testing is going to decrease. So there are thousands and thousands and thousands of different tests. You can really chase yourself into a hole. It's not the easiest question to answer, and I think so. The big thing is, looking for that question of, is it going to affect what I'm doing? And if it may, if it's a choice where, and I think your case is a very good example. Finding the Lyme disease was the thing that propelled your recovery, and so it did have great value, and it definitely changed your life in a positive way once you headed in that direction. Right. But I see so many physicians that are just shotgunning tests, and without really understanding why they're ordering each test, and sometimes that can be harmful. I don't know if that completely answers that question.
Yeah, no, I think that helps you get good guidance. I think that's a great advice for physicians and great advice for thought.
Yeah.
Yeah.
Well, the other thing too about tests is that medicine is an art. I mean, I do science for a living. I've trained in rigorous institutions and have published in scientific journals. But as a clinician and as a patient, and I tell people this, physicians may not like this, but what we know about the human body from a scientific perspective, I think you could fit into a thimble.
Yep.
And so I don't think we're going to have the answers through science. I mean, this is why, the earlier question about getting away from, the clinical exam and listening to people, we can't lose the art of medicine. Yeah. We are not going to make this an exact science, and that's just not the way. And anyone, I think, who thinks that this will be an exact science taking care of a human being is grossly naive, quite frankly. So I think that tests are good. Tests can help us narrow things down, but at the end of the day, as clinicians, we've got to use our clinical skills, and we've got to rely on we've got to be able to listen. Being a clinician, being a really good clinician means being a good listener more than anything else. And if you don't have a good clinician, if your doctor doesn't listen to you, I'd say find a new doctor. So, the best clinicians that I know are the ones that don't need a test and can sit there and do an exam and pretty much tell you what's going on without having to get, MRIs and CT scans and other things. So I think tests are important. I personally believe that we don't have good testing right now. There are people working on tests for Lyme, for some of these other polymicrobes, and for multiple strains and species. But I think right now, the physicians that I see who are really the giants in this area are people who have good clinical judgment and also have good gut instincts when it comes to taking care of people.
Great. I want to build on that direction. As far as working with your physician, Dr. Spector, can you speak a little bit about why a good relationship is key to recovery? How it can change your course of treatment?
Yeah, I mean, look, there have been study after study, and this is just such common sense, that patients who feel empowered and are actively participating in their care do better. I don't care what the disease is. If they have diabetes, they tend to have better blood sugar control. If they have high blood pressure, they tend to follow their diet and exercise. The reality, though, is that most patients, and they've done studies, most people who go to doctors come away feeling like they've just heard a lecture rather than feeling like they're an active participant. And so I think it's incumbent. Look, no one cares about your health more than you. You could have the most compassionate doctor, but in the end of the day, you're the one who's going to suffer the consequences or benefit. And so I tell people that one of the worst things about having a chronic illness is that feeling that your life is out of your control, right? Sure. You're told, show up at this time for your scan, get this blood test, take this medicine, do whatever. You feel like, a puppet, somebody pulling the strings. I tell people all the time, you have control. Do not abdicate control over your life, over your health to someone wearing a white jacket, okay? So healing is a joint process. It's an interaction between a practitioner, doesn't have to even be a physician. There are tremendous nurse practitioners, physician's assistants. It's between a healthcare provider and you. It's a team effort. This is not somebody telling you, listen to me and I will cure you. That's not the way it works. Even the people that I've helped with cancer, I'm not that egocentric that I would say, that was my therapy that I gave them that cured them of the cancer. No, you know what? It was that person and whatever they did to their body, whether it was diet or exercise or mind body or stress reduction or praying. I'm a firm believer in the power of prayer. It's all of those things, perhaps plus my treatment and their body being more receptive to whatever I did that led to a cure. And so whatever you do, if you walk away from this evening with one important message, is that do not give away your power. You've got tremendous power to heal yourself. And what you need to do is develop a relationship and find a physician who is willing to develop a relationship, who will listen to you, who will work with you, and who won't sit there and feel as if because they have an MD or a diploma from Stanford or Yale that they can talk down to you. So I think that if you can't develop a good relationship with your doctor, I think time and time again studies have shown that people tend to do worse who feel hopeless in that relationship.
I think that's such an important point. Is there any more advice on how you can, as a patient, take back your control and when, if it's just not working out, when you should cut your losses and find a new provider?
Well, I know, speaking for myself, that I'd be dead if I didn't take control of my life. If I sat there and said, yeah, I think you're right, listen to your gut instincts. Your gut instinct is not just an upset stomach. Your gut instinct is something inside telling you there's something wrong here. Now, that's not denial. It's not the same as denial where you say, I'm fine. But if your gut instinct says, I don't really believe like mine did when my doctors were saying you're stressed, and I knew that something was wrong. If I had just stopped, taking the reins and saying, I'm gonna not stop until I figure this out, I would have been dead a long time ago.
Yeah,
so,
I agree with that.
Yeah, if you need, this all gets back to no one can care about your health more than you. And you've got to care enough about your health that regardless, as I said, if you feel that you're not getting adequate care, I'd say go find somebody that you feel comfortable with that's good, and stick with that person.
Sure. Yeah. It's sometimes that is easier said than done. I agree 100%. And the 10 years that I had my medical practice and all the people that we've come in contact with the programs that we do, which ranges in the thousands now, the people who get well are the people who take personal accountability. Personal accountability is key. And beyond that, what we try to do in our programs and what we need to do more of in the medical system is patient empowerment, giving people the skills that they need to change their own situation instead of being this dependent person who's sitting there frightened, fearful, and has nothing to do. When people make the decision that they are going to get well, that's when their recovery starts moving in a positive direction. The frustrating part of all of it is that a lot of physicians do get trapped in a situation where it's very difficult for them. I found that, I did an OBGYN practice for almost a little over 15 years, and then I did primary care and with this idea of wellness. And I wrote all these programs. I'd send people home with CDs to read, and I took like an hour or more with every single patient, stepping them through trying to help them with that patient empowerment. I tried to be the physician that I wanted to find myself. And what I found was it was extremely taxing. And because the system rewards physicians for doing procedures and not for counseling, that it's very, very hard to make a living. There were years that I had a hard time paying my staff, much less taking home a paycheck, because the more I made my patients healthy and empowered them, the fewer tests that I did, the fewer procedures that I did, and the lower my reimbursements got. And it was very frustrating. So the other side of that is I would suggest, be sensitive to your physician's situation, that they may want to give more. And here they are with a computer. They have to do the EMR to get the code to get paid. So they're in a very frustrating situation. A lot of physicians are very, very unhappy in their profession. So one thing I would say is be kind to your physician, be kind to your provider, be sensitive to their situation, which can be as frustrating as the frustration you're having with them. I used to tell people to try to give them guidelines. No physician wants to see a patient who walks in the door with a list of 20 symptoms and all kinds of problems, because they've got 15 or 20 minutes to figure it out and change that person's direction. Well, they've got really enough time to start writing prescriptions, and that's about it. So I would encourage people to be very specific for what you're asking of your provider. Limit it down to one key thing that you want to address with that visit, and be sensitive to the fact that your physician may not have the time that they actually want to give you.
I think it's a great point. That's the other thing that I would recommend is prep for your doctor's appointment. You can't, because there's limited time, you can't go in and wing it. So you should come in ready to have a priority list of, I need these 2 points addressed today. The other thing that I would say is that, and I never object to this, if somebody said, can I record this? Because often people come in, they're in a doctor's office, the stress of being in a clinic, and they forget exactly what you told them. So I'd say either bring somebody with you who's medically savvy or can take notes, or record it and go home and listen to it. And so, and some of the worst medical mistakes are people not following instructions because either the physician didn't have the time to explain it properly. So come prepared, have your list. If there's one thing that you want to have addressed and it's not addressed, then I wouldn't leave the office until you have it addressed. And I would either record it or make sure that somebody's there so that when you go home, you can listen to it again. You can say, oh yeah, that's what they told me to do.
That's great. That's great advice, both of you. It's really, Dr. Rawls, especially mentioning, a lot of people don't think about the position that the physician is in. And I think that ties in really well to the next topic of Lyme awareness. And just the fact that there is such poor awareness around Lyme and a lot of these other lesser known conditions. They're according to the CDC, estimated 300,000 cases in the US annually, new ones, as opposed to breast cancer, invasive breast cancer, 253,000. So even though there are probably more cases of Lyme, a lot of people do not know about it. Insurance doesn't often cover it. So let's talk a little bit about why isn't there more awareness about these chronic illnesses in the medical community, or why there isn't more investment in diagnostics and treatments?
Well, I mean, doing research, I could tell you that the priority of the government. So the majority of research comes from the federal government, whether we like it or not.
Yeah.
And so that there's a priority, and the priorities are based on what the people at the NIH are told. And so if they're told, so obviously cancer is a priority, people are, dying of cancer. I mean, despite the fact that we've made advances in diagnostics, I mean, 40,000 women a year still die of metastatic breast cancer. And some cancers we haven't really even, breached, pancreatic cancers and brain tumors. Now, if the people in DC are being told by the experts, the Lyme disease, this is an easy to diagnose, easy to cure, then why would they want to spend money on that? Or if Bartonella is not even on the radar screen, I mean, forget Lyme disease, Bartonella, no one even talks about.
Yeah.
And I mean, we talk about it, but in DC. And so the priorities, what people are hearing, if what people were hearing in DC is, this is like a huge public health crisis, and 340,000 is just the tip of the iceberg, then and children are being just completely decimated, their lives, and dropping out of school and unable to function, and people are dying from these diseases. This isn't just sort of a nuisance. I've got some arthritis, I've got some pain, I feel fatigue. People are dying all the time from this. I mean, I came about as close, given 72 hours to live, as you can come from the ravages of these diseases. So if people heard that message, then we'd see change, quite frankly. And so I think that until that message is heard, that wow, this is one of the biggest public health crises that we face, there's not going to be much change, quite sadly.
Yeah, I think I like to talk about it from a point of view of virulence. The same topic. Virulence is the propensity of a microbe to cause illness. And when you look at Lyme disease, most people who develop acute Lyme disease don't get very ill. You didn't remember a tick bite. I didn't. I got bitten by ticks all the time. So it's harder for physicians to understand an illness that doesn't cause a severe acute illness, but people develop chronic illness that's hard to find. It's hard to find the microbe. So it's very frustrating. We like things that are well defined. We like something. So when you're talking about something that gets attention, let's talk about a highly virulent microbe. Let's talk about Ebola virus. Look at Ebola and the stir it caused worldwide. Everybody on Earth was afraid of getting Ebola virus. And it was really not very widespread when you look at the total world's population. But it was very sensational because it was a very highly virulent microbe. Virtually everybody exposed got sick. They got very badly sick, and most people died when they got it. That created a sensation, and money poured in from all directions, and we were able to contain it. So that's looking. So looking at Ebola and how it affects people, which is really a much smaller scale than Lyme disease, but there's two so different illnesses. We tend to look at things and get excited about things that are acute and severe. And most of our medical system is designed to treat acute illness. That's what the whole thing is based on. So we do a really great job treating acute illness. We had all the scientists of all the world looking at Ebola virus and how do we contain this thing, and how do we build vaccines and drugs for it, and how do we keep people alive. Whereas if you've got this other thing that's just smoldering all over the world, but it's hard to define and we don't understand it, nobody wants to mess with that thing.
Yeah. It's funny, the acute illness, chronic illness, as internists, the majority of what we treat are chronic illnesses, right? The people who cure disease are surgeons. You got appendicitis, they take your appendix out. High blood pressure. We don't cure high blood pressure. We've converted it to a chronic illness. I mean, people live long, as long as you take your medicine or live the lifestyle. I don't want to get hooked on the medicine, but as long as you do what you need to do, you can live with that. Diabetes, we don't cure diabetics. They live, you know, long lives, thankfully, most people. We don't cure asthma. I mean, you can go down the list of all the medical problems that in internal medicine, we don't cure, but we've managed to have people, you know, live long lives. Some of the medicines are not easy to take, and I think that's where, Bill, you know, things like lifestyle and medicinal herbs come into play. But very rare, I tell people, we don't cure, I don't cure a lot of diseases, and I never have, because, you know, if you've got high blood pressure, the minute you stop taking your high blood pressure medicine, there's a likelihood as your blood pressure will spike and you could have a stroke or heart attack or whatever.
I can give a little personal note on that one. When I was in my 30s, my mid 30s, high stress lifestyle, you know, working 80 to 100 hours a week, taking call every second to third night. At that time, not a good diet. I grew up in the fast food generation. I was diagnosed with essential hypertension on any given point when I went in. This was started when I was in residency. They would check my blood pressure and it would be 150 over 100, 150 over 110. I tried all the medicines and I just did not tolerate them well. And I finally just said, you know, that's how I'm going to go. I'm going to have to live with this. Then Lyme disease came along and I did all the lifestyle changes and embraced the herbal therapies and the diet and all of the things that you should do to overcome a chronic illness. And you know, guess what? Here I am at 60. I take no medicines for hypertension. At any given time, my blood pressure typically runs about 115 over 70 now. And what it shows is what we're doing in a lot of cases is we're treating the process. We're blocking the process artificially. Mm-hmm. But when I started that recovery process, it was restoring everything in my body back to normal, including my cardiovascular system. So I didn't have this, I wasn't genetically prone, and I didn't have this essential hypertension that I was genetically born to have. I was just not treating my body well. Right. And it was really doing a number on my cardiovascular system. And once I stopped doing that, I went back to normal.
Yeah.
Yeah.
All right, thanks. Let's move on to the future of treatment for these things. Dr. Rawls, if you could start us off. I know you left conventional medicine to pursue more natural approaches, both for yourself and for others. How do you think that line of work, of approach, will progress in the future?
I think there's a place for everything. You know, I often show that little diagram of the pyramid with the restorative, symptomatic, and heroic therapies, and I think that within our medical system, or possibly even outside our medical system, I mean, that's so much a big part of what I do now, is that patient empowerment, teaching people that, you know, when you go about your life with self-destructive behavior, you're going to get sick, and that living a life where you're eating good food, you're looking at how you're balancing your life with stress and work, and you're doing things that you enjoy in life that promote well-being, and you're going to end up with an exceptional lifestyle. So that's education. That's certainly within the medical system. I've said many times that we probably need more health coaches than we do doctors to help people understand what they need to be doing to create a healing environment in their body. And then, you know, we leave everything with the other things to the medical system. So all the things that Dr. Spector is doing with these really innovative immune therapies and things that we're doing in cancer research, We have to do all that too. But you can't rely only on that. You have to look at the thing from patient education, from helping people understand how to help themselves, and help them understand how to use the medical system better. Then we can start devoting those resources, and the need won't be as great. If you've got a whole population of people that is following self-destructive behavior every day, your healthcare bill is going to be extraordinarily high. So if you can have people doing prevention and doing things that are helping their own situation, then we can start targeting those resources to a smaller need, so it makes a bigger impact.
Yeah.
And Dr. Spector, I understand you've done a lot of research on immunotherapy for cancer cells and possibly microbes. Can you talk about how that might translate to therapies for Lyme or other chronic illnesses?
Sure. Yeah. I mean, it's interesting at my lab now. This is one of the consequences of getting Lyme disease, has really transitioned pretty remarkably from cancer research to research in Borrelia, Bartonella as starters. And using the lessons that we've learned in cancer research. So we don't need to reinvent the wheel here. I mean, we've really tried to get away from chemotherapy. It's certainly not mission accomplished yet, but the immunotherapies, the targeted therapies, drugs like, Herceptin, women for breast cancer. And so one of the things that I said to some of my colleagues was, why don't we take some of the lessons that have been successful in this new paradigm of cancer treatment and look and see if we could apply them to the treatment of these chronic illnesses, of these chronic pathogens. And so we actually have a very active program, really twofold. One is to develop targeted therapies, so these sort of smart therapies that are selected based on the microbe. And we're working, a lot of the genomic data for these microbes is known. So we've got databases for hundreds of strains of Borrelia and species. So we're looking at targeting targets, proteins, that we believe are intimately involved in the survival of these organisms that will not cross-react with our normal tissues and will not cross-react with the normal gut microbiome. So these are not antibiotics, these are smart therapies. But will cross-react with multiple strains and species of the bugs. So that's one. The second is that for the longest time, the holy grail of cancer has been, why doesn't the immune system recognize a cancer as being foreign and eliminate it? Now, the transformative treatments in cancer that now are capable of unleashing your own immune system. Again, this is sort of the holy grail. Let's have a person's own immune system recognize the cancer as foreign and eradicate it. That research was not specifically done for cancer. That came out of chronic viral infections.
Yeah.
So we know that when your immune system is activated, let's say you have a cold or you cut yourself, you activate your immune system. Almost as soon as you activate your immune system, there are changes to shut the immune system off.
Yeah.
Otherwise, we'd all be one big walking ball of autoimmunity. And so there's sort of this yin and the yang. You activate it, and literally, as you're activating the lymphocytes and other effector cells, you're already starting to shut them down.
Sure.
Now, cancer cells, and again, chronic viral infections, figured that out a long time ago. Hepatitis C, hepatitis B, some parasitic infections, leishmaniasis, they run below the radar screen just like cancer cells, because they figured out that the normal brakes on the immune system, they've hijacked those brakes. Yeah. And so the immune system becomes fatigued. The cells, if you look under a microscope in a cancer cell, often you see a bunch of lymphocytes right outside the tumor, and it's almost like there's an invisible block. Well, we figured out for some patients, and not enough, but we're developing. This is the hot area in cancer, and I think for Lyme disease, how to take that invisible shield away and make those pathogens, whether it's a cancer cell or whether it's Borrelia that's hiding in tissues just like cancer cells, make them visible to the immune system. And it's remarkable. I never thought that I would see a day when I can walk into an oncology clinic and tell someone with metastatic lung cancer to their brain, to their bones, to their liver, there's a chance we could cure you without chemotherapy. And in fact, I could tell you that, when I go to clinic every Thursday morning, I see people with metastatic bladder cancer, lung cancer, who are 3 and 4 years out with no evidence of disease, who I think are going to be cured without chemotherapy.
That's awesome.
And you could see when their immune system starts to kick in, that tumor on a scan just starts to shrink away, and that's it. And so what we're trying to do is say, those drugs are out there, those antibodies are out there that are doing that for people, Jimmy Carter with metastatic melanoma, he's sort of the poster person. Why can't we do that for chronic illnesses like Lyme disease and Bartonella and Babesia and Ehrlichia, and along with the sort of things that you're doing to really have the perfect storm in a good way, to have that immune system overwhelm whatever is there, whether it's a cancer cell, whether it's a stealth bacteria or bacteria. That is the ideal. That's the ideal scenario. I mean, I am not one. I am certainly not an oncologist who loves to think about chemotherapy or radiation. I am not somebody, having gone through antibiotic treatment, who likes to think about antibiotic therapy, although I am certainly one, there's a place and time for antibiotics that save people's lives. But optimally, we need to harness what our bodies were meant to do. Our bodies are incredible, we're incredible beings, if you want to call it a machine. Every time I think of the body, I get more spiritual in nature. We were meant to heal. You cut yourself, there's a whole coagulation pathway that forms clots in your platelets. You have an infection, your body was meant to heal itself. The problem is what we do to ourselves interferes with our innate, our body's real drive to heal itself. So we eat crappy food, we don't exercise, we smoke, we drink lousy water, we breathe in bad air, we're stressed. We do all the things to try to prevent what the body was meant to do. But I think we're at a tipping point. We're at a really transformative point in medicine, certainly for cancer, and I believe for these chronic infections, where we're starting to really figure out how to harness the body's immune system and to use it to our advantage. I know I'm speaking to the choir, and you can't see this, but I'm looking at all these wonderful these wonderful medicinal herbs that Bill has in the corner here. And listen, I feel healthier just sitting here. So my blood pressure's lower. I feel as healthy as I've ever felt. But I tell people, certainly in cancer, the best cure for cancer is prevention.
Sure.
And so, we do need to really focus, for those of you who are healthy, you should count your lucky stars and do whatever the heck you can to maintain that health. And that's, there's not one thing, there's not a one size fits all, fix for this. It's, I think there are incredible benefits. And, even though we come from different sort of different spheres, I'm in the academic scientific research world, you're in the, an equally scientific world, just a different aspect of that.
Right.
I think we share a lot. We've talked about joining forces and doing some research together.
Yeah.
But I think that the future, to get back to the future is what you're doing here, I think what we're doing, and marrying those together in an incredibly powerful tsunami of well-being.
Sure.
And so, anyway, I don't know if we still have time, but I think there's, when I look at this and I get emails and calls all the time from people with Lyme and Bartonella, and they've been through, supplement regimens, they've been through antibiotics, they're not getting better. I tell people there is a lot of hope on the horizon. There's hope right here at Vital Plan, and I have no stock in this company. So I truly believe, and I send people here because I think this is such an important part of well-being and healing, just as exercise and mind, body, and all the other things we should all be doing. I think there's a lot of hope, and I think that in the not too distant future, you're going to, as I said, see the things that people like me and others are doing to harness our own immune systems along with what you're doing. And I feel almost giddy at times thinking about the possibility for that.
Yeah. We live truly in exceptional times. I was looking back at statistics for 1900, and average life expectancy was 45. That doesn't mean that people didn't live a long time. A lot of people did, but a lot of people died in childbirth. A lot of people, the top cause of death was tuberculosis. Second to that, pneumonia, intestinal infections. So we've done so much with technologies for, modern antibiotic therapy used appropriately, vaccines. There's so many things that we have changed. But now, it's we've got this world where we've got this chronic illness, and it's not just because people are living longer, because we're seeing chronic illness in 20 years old regularly now. So we have all these pressures of the modern world with toxins and these bad food and all these things. But what we have is we have choice and we have knowledge. And because of the internet, that knowledge is disseminating very fast. So people can have the choice to be healthy. You really don't have to wait for the future. We've seen just equally transformative things with people just changing the way that they go about life and embracing these things of creating that healing environment of the body, which you really don't have to have high technology to do. You just have to make the choice to do it. Wow. So we look at all of it. The future is pretty bright for the people that want to make that special choice.
You guys are full of so much great information here. The time has flown by and we're already at an hour and 10 minutes. So thanks for everything so far. I do want to move on to Q&A so we can at least answer a few of these for folks. Yep. So if you could, the first one here, I know you're both very active guys and then went through this pretty intense chronic illness. One of our viewers out there is curious about how did you regain your physical stamina and endurance and kind of ability to get back to being active? So just briefly, each of you maybe share your top kind of advice there.
Yeah, well, one thing that I did is I was never inactive. And so even, and obviously I wasn't running marathons when I was really sick, but I never, one of the worst things, and I realized that the guidelines for chronic, I guess it's no longer called chronic fatigue syndrome, have changed, that they used to recommend just exercise. Now it's not just exercise, because I think it's clear with some of the pathogenesis or the pathophysiology of the disease. I'd say for a lot of people though, and I've seen this, I saw it in myself. I sat in a transplant room and I had what's called a aortic balloon pump to keep me alive. That was a huge catheter put in a big vessel in my groin, thread up into my aorta, that really on an emergent level kept me from dying. And I saw, and I was even though I was sick for 17 years, with 10% heart function, I was on the elliptical exercising like a banshee. Probably better than most people my age with normal heart function.
Yeah.
And so I knew that if I got deconditioned, so deconditioned is one of the worst things that can happen. Number one, it's a vicious cycle of you feel fatigued, your muscles become deconditioned. As your muscles become deconditioned, they release inflammatory mediators. Your muscles are a huge reservoir of inflammatory mediators. And so it becomes this cycle of, not doing things, getting worse, and you feel worse, so you do even less. I tell people that, whatever you can do, and I think that going for, physical therapy and getting hooked up to, wellness counselors and health coaches, but even walking around the block 3 times or walking for 10 minutes is better than not doing anything. And so I literally, when it came time for the transplant, a month before the transplant, I was working out on a treadmill.
Yeah.
And so I didn't come into a major surgical procedure completely debilitated. My recovery would have been probably a year or more longer than it was. Had I not come in having maintained my physical, presence, again, not letting myself get deconditioned. So that was actually my secret. I also took the one supplement that I took. I think the Japanese take it like crazy. I think there's large studies now being done in the US looking at ubiquinol, or CoQ10, which is an important component of the mitochondria, the little energy producing areas of our cells. Yeah. And the organs in our body, the big muscles, your heart notably, uses a lot of energy. And so for me, I read a lot of the literature on ubiquinol, and I took lots of ubiquinol. Now I'm an N of 1, but I personally believe that I did as well as I did through exercise, through mind body, and through a lot of ubiquinol. So I, 24 hours after I was out of the surgical ICU for my transplant, I was walking 3 miles around the halls of the hospital.
That's awesome.
Yeah.
I think that's the message. Never give up. Retrospectively, I think one of the things that was helpful to me is I really didn't have the option of declaring disability. I had to push through it. I mean, there were some days where I would crawl in the back steps of the office and paint a smile on my face and go see patients. And I reduced my patient load. I created a situation that I could control to reduce the stress, but at the same time, I was always working toward trying to figure things out, trying to move me forward. But in my particular case, when I really embraced herbal therapy, I mean, it was, my wife thought I was insane. I ordered all these bottles. I had a shoebox full of bottles of supplements, and I was taking these massive amounts of capsules 3 times a day. And I started getting well, and it was an up and down course for a number of years after that, but it was obvious to me that that was making a huge difference. So for me, the herbs were key. I had done things to control stress. I stayed active. I did all of those things, but the herbs made a huge difference, and that was the thing that was key in my personal recovery.
Yeah.
Great. Thanks, guys. And since you both had some heart issues, another viewer out there is wondering, how does someone know whether organs have been compromised forever, especially when they've got dramatic symptoms, or when you can have regeneration, you can return to full function?
Yeah. Well, I get a lot of calls because people say, I don't want to end up like you. Not that there's anything wrong with me, but that I don't want to get a heart transplant, which I wouldn't recommend a heart transplant to anyone. So unless you need it. I don't know that there's a great answer for that. I think thankfully, first of all, the body has tremendous capability of regenerating. Even the tissues that we normally were taught in medical school don't regenerate. So, even in adults, the brain, the heart has capacity to regenerate. I mean, we've seen that with people. I mean, there was a book written by a woman who had was a neuroscientist, had a major hemorrhagic stroke on one side of her brain, yeah, and rewired her brain as an adult. So I think thankfully, with the proper lifestyle interventions and I think treatment, most people will not go down a path of irreversible organ damage, but it can happen. And the longer I think things are delayed, either a diagnosis or initiation of treatment, whatever that treatment may be, the more likely the damage is done. We know that there's another relative of Borrelia, another spirochete called treponema, which causes syphilis. And there's 3 stages of syphilis. And when you get to the tertiary stage, which is late syphilis, you can halt the progression, but you can't necessarily reverse the changes. So I think as you've stressed, I think beautifully and very importantly, early intervention is the key. Lifestyle, whatever that may be, and if there's better therapies, immune-based therapies, earlier intervention. I don't particularly know of a test that can tell you whether people ask me all the time, how do I know if I have carditis? There aren't, I mean, people do heart MRIs, which, you know, may show inflammation, but there's not a specific test that says, oh, you've got Lyme carditis. Again, a lot of this is clinical.
Yeah.
As a clinician, you've got to put the pieces together. So, so I'd say that, you know, best to get treated early, best to try to make a diagnosis early, although I realize with lousy diagnostics, that's difficult. And with often with physicians not listening to patients and their problems. And, you know, I mean, I went to multiple doctors before I was finally diagnosed. But I think the earlier you can intervene in some way, the better, and the less risk of having some permanent irreversible damage.
Yeah, I agree. It is always remarkable to me how much people can get back, though. And it's creating that healing environment. You know, when we talk about all the things that we do as physicians, but I think Dr. Spector has really hit the nail on the head. Is that, you know, the things that we do are really, you know, the best things we do are just helping the body do what it needs to do. And so the more that the person can create a healing environment in their body, it's remarkable what can come back. But back to talking about the future, I think we're really in the very infancy of learning about stem cells and how we can use stem cell therapies. But there is a lot of potential there for doing a lot of things. So I think the future is very bright in that area also.
Yeah.
Thanks, guys. And we've got time for just one or two more questions here. The next one is, when you had trouble with the medical system, what were some of the other either practitioners or practices or supports that you used to support yourself along the way? So Dr. Rawls, maybe we can start with you. If you guys could each say just briefly, you know, what resources there might be out there that people have not thought of that are really beneficial for them.
Yeah, I think anything that enhances the ability of the body to heal itself is valuable. You know, I started doing yoga many years ago, and I found that was very valuable. In recent years, I've been doing Qigong, which is an ancient Chinese art of movement. Tai Chi is a form of Qigong. Acupuncture, and Dr. Spector mentioned before when we were talking that he has done quite a bit of acupuncture. So any of those things, anything that helps balance the systems in the body, helps balance the energies of the body, can have a healing effect and can be beneficial.
Yeah, I agree with that. The one thing I'd say is my wife. She's the best resource. Hopefully she's out there watching.
Yeah,
this.
mine too.
Yeah,
I would agree with that.
And actually, I really mean that, because I think having a supportive environment is healing. And so, you know, that is so important. And we undervalue the caregivers and the role that they play in healing. And so, yeah, I can promise all of you that I would not be sitting here alive today if it hadn't been for my wife.
Awesome.
Thank you all. And the last question here, so many people are just wondering, you know, what are the chances for them to be well, looking for hope. And I think you all both have such powerful stories. If you could just close with any last words of wisdom to help people out there.
Keep the faith. It's here.
Yeah, absolutely.
Seek out the people. The people are here. Try. If something doesn't work, try other things. You know, I tell people tell me all sorts of things that may seem cockamamie to me, but you know what? If it works for you, that's great. I've done things for people, and I never forget treating somebody on a clinical trial. They had a complete response. That they're still alive today, 20 years later, from kidney cancer. The other, you know, 99% of the people on the trial did not respond. I said, it's 100% for you.
Yeah.
So it doesn't matter what happened to everybody else. For you, it's 100%. So I would say, you know, change is here. more change is on the way. The thing I used to tell my patients, my cancer patients, is try to stay as healthy as you can, because when the cure comes, and I do believe, I'm going to tell you this, people say to me, my doctor said there's not going to be a cure for these diseases. I'm not somebody who likes to give false hope, but I'll say if we can cure metastatic cancer, which is mutating every minute that you watch it, I refuse to believe that we can't cure these diseases.
Sure.
So if that's not hope, then I'm not sure what else I could say.
Yeah, and I think the big thing again is just being accountable. It's the people that get well from anything, I think, are Lyme disease, cancer, or anything else, the ones that get well. All these technologies are wonderful and all these things that we're doing, but if that person doesn't take personal accountability for their own well-being, if they're not putting forward the effort to do the things that they need to do to help their body to heal itself, then it's just not going to happen, no matter how good the technologies are. So I think that's important. I think learning about yourself, that self-discovery process, and that's something that I've been through with so many different kinds of patients, Lyme, fibromyalgia, everything else. People that come through it and they're on the other side, and they it's like crossing the Atlantic Ocean, I tell them, or climbing Mount Everest. When you do that, when you learn the things that you have to do to create a healing environment in your body, you learn special skills that no one else on earth has. So people that go through that recovery process and they end up on the other side, they're different people. And they all want to get back because they've had this profound thing happen, and it's really special. It's life changing. I know it has been in your case, in mine. So I look back and how this thing has changed my life, and it's given me opportunities that I wouldn't have had before, and my life was compromised for a long time, but it's hard to trade it from all the other things that it's meant to me. So I think you have to embrace that.
Yeah. Okay. Make one last comment.
Sure.
One last for me.
Go ahead.
Do we have one more comment, or are we done?
No, go ahead. Go ahead.
I just want to tell you this. Do not let your disease define who you are. You are not Lyme disease. You are not somebody with breast cancer. You're not somebody with fibromyalgia. You're a human being. The medical profession has a way of, in a sense, dehumanizing people by, when I make rounds, often the residents will say, oh, that's so-and-so with breast cancer. I said, it's not so-and-so with breast. That's not who they are. Yeah. That may be something growing in their body, but they're, a loving mother. They're, so do not, one of the things that helped me, I shouldn't say never. I tried not to define myself as Neil Spector, someone with cardiomyopathy. And I tried to live every day as meaningful as I could. Some days, like you said, I didn't feel like getting up. But you know what? I never let the disease get to me. And trust me, there were days. I mean, I lived with a defibrillator pacemaker, and there were plenty of times when I was, 1 foot in the grave and 1 foot still on terra firma. And living every day with the sword of Damocles hanging over my head that I could die at any minute. So I get it. I understand what it's like out there. But do not walk around saying, I'm so-and-so with Lyme disease, poor me. That's not who you are. And again, I'm not saying it's easy, but you're not who your body, you're not an ailment, okay? So if there's one thing, walk away, take control of your life, seek out the best care you can. Do not let a disease define your life.
Absolutely.
Awesome. Well, thank you guys. We could go on forever. I know there's so much to share, and really hope everyone has benefited from hearing all the wisdom from both of these really passionate doctors about about this field. So I want to thank you, Dr. Spector and Dr. Rawls, for being here tonight and answering all the questions that you did.
Thank you, Tim. Thank you for the whole crew. I mean, it's an amazing group here. So I really appreciate all your help, and
well,
thank you again for having me here. Yeah.
Oh, it's a pleasure. Hope we get to do it again sometime.
Absolutely, definitely.
Yeah. Hope so too. Thanks for being our special guest tonight, Dr. Spector, and hopefully we'll see you two together on another webinar soon.
Yes.
Awesome.
Yeah.
All right. Thanks everybody for sticking around through this. We hope you got a lot out of it. Just want to let you know, these are some really interesting stories. If you want to know more about Dr. Spector's story, we encourage you to check out his memoir, Gone in a Heartbeat, A Physician's Search for Healing. We just did a review on that recently at rawlsmd.com. You can read a summary there. And if you want to purchase it, you can find it at Amazon. And then also Dr. Rawls' book, Unlocking Lyme. Less of his personal story, but more just a wonderful resource for Lyme, which is a great model of a lot of chronic illnesses and has a lot of overlap. You can find that at unlockinglyme.com. And then also we've recently updated one of our most popular articles called The Boiling Point, and it touches on a lot of the issues we talked about tonight and many more. It's highlighting a lot of natural approaches that can be really supportive for Lyme, fibromyalgia, and chronic fatigue and other similar conditions. So we're going to be releasing that soon. We're really excited about it, and we're going to be sending you all the first release of that. Thanks for attending this webinar. So keep an eye on your inbox for that. So thanks again for being here. We hope you tune in for future webinars with us. We will be having some more in just a couple of weeks. And we'd love to have your feedback for the webinar tonight. So when you exit the webinar, if you could, super quick quiz or survey, just let us know what you thought, a little 5-star rating, and any other thoughts about how we can improve this or what worked really well. We would greatly appreciate it. So have a great night, and we will see you on the next webinar. Goodbye.